So I've just come here to Bundoora Park to kind of reorientate myself. This is a fantastic area with red gum trees that are ancient, huge trees that predate European settlement and kind of put things back into perspective, and place where I like to take a long walk along here too. So I was sort of taking a little time to reconnect after being inside these whirling machines, one to do upper body scans, PET scans to check whether there's any re-emergence of tumours, also some routine blood tests, and then another CT scan just to satisfy my oncologist's curiosity to see if there's any emergence of tumours there. With lung cancer, there's a related, in stage 4 lung cancer, where it's going out into the body, into other areas. There's some related areas, obviously, adjacent to the lungs where it might come out. There's the lymphatic system, which I had tumours. There's the adrenal gland where I had tumours, and in fact, the thyroid area, I also had tumours. So, and I believe reading, the brain can be another place where the lung cancer tumours will be migrating to. So I've, had that kind of experience back 6 hours being human guinea pig in machines and scans, these very expensive scanning machines, and talking to the people who are administering them. And again, just really talking about the volumes, even in some of these older machines, 60 patients a day going through. They're upgraded and retrograded, so they keep going, but just the massive scale of the disease in terms of that, and of course then also kind of puts in perspective too the importance of early detection, and we've had some discussion in this country about a major boost to that in terms of scanning, because obviously stage 1 is easier to recover from. Probabilities for stage 1, stage 2, stage 3 cancer are much better than stage 4 cancer, and particularly in some cancers such as lung cancer that have very aggressive outcomes. So just brings you all back into that kind of institution and puts you a bit more into patient mode, so more reason for me to wander off here. And I'm taking some heart because I went to book in the oncologist and they said, earliest you can see an oncologist is 4 weeks. So I understand they're under incredible pressure, and again, this is the scale of the disease, but I'm taking heart from that, because if they don't want to see me until 4 weeks, then I'm obviously not on the priority list, and I'm just on the watch and observe list. But I suppose these 3 monthly or 6 monthly checkups are a good kind of reality call, just to remind yourself that even however remarkable to see 4 centimetre tumours all suddenly clear up and disappear and become tumour free, there's still cancer cells in my body, and that this notion of suddenly you're cured and etc. Is a bit false, because I'm now back in the boat with everyone else, especially the 50% of Australians who are expected to develop cancer, because relapse is a possibility, regrowth is possibilities. We've seen that obviously with high-profile breast cancer patients connected to Austin and Olivia Newton-John herself. So in many ways, the scans kind of brings you back to earth, and the anxiety of waiting for 4 weeks is kind of time to reflect that there is no going back to normal. That if, as in my case, there's multiple issues that cause the suppression of the immune system, multiple reasons and no pinpointed reason, multiple diet, lifestyle, stress, etc. If that's the case, then there's no going back to what passes as normal in terms of diet, lifestyle, and that I've still got to kind of focus on what are the emotional, mental, dietary, exercise, physical things I need to do to keep my lymphatic system, keep my immune system at 100%. And you know, while most of us want to put cancer out of our minds, you know, the reality is that this current diet, this current lifestyle is going to, in both men and women, bring 50% incidence of cancer into our lives and into our families' lives. And for some people with extra occupational risks or dietary risks, the 50% level might be a lot higher in your family. I know it's a lot higher in my family. So kind of, again, just to kind of recap and readjust, refocus, I suppose, on, you know, what do I need to still do to maintain a tumour-free body? What do I need to, you know, still maintain and do to adjust my immune health? And, you know, some of these things I've now learnt, some of these symptoms in my body, which aren't cancer, but they're symptoms of a bad lifestyle, I've got to actually make them my benchmarks about how I manage my life and how I, you know, move from what I call a work ethic, move onto a life ethic, where you're actually focused on the whole health of your body and the whole balance of your lifestyle. And just enjoying some fantastic sun before the winter really starts.